Good afternoon. I'm Tim McLean with HHSA Communications. You'll hear shortly from Chairman Cox, Supervisor Fletcher, two doctors, and the Director of County Emergency Operations Center. We have a different format today, with the video being streamed live to the TV news stations. For the Q&A, please call the number on the media advisory. If you're texting a question, please identify yourself and your station in that question. As in the past, please limit your questions to one question and one follow-up. Thank you.
Good afternoon and welcome to our daily session on briefing on COVID-19 virus. Again, I'm Greg Cox, Chairman of the San Diego County Board of Supervisors, and we're here again to provide our daily media briefing on the status of where we are with this virus. Today we're going to hear from Jeff Toney, who is the Director of the County's Office of Emergency Services. He's going to be talking about our emergency operations and our COVID-19 response. Then we're going to hear from Dr. Wilma Wooten, who is our county's public health officer, who will give us an update on the numbers and the medical situation. Then we will hear from Dr. Nick Ifantidis, our chief medical officer, who will talk about our emergency management system and the healthcare workforce. And then we'll hear from Supervisor Nathan Fletcher, who will bring us up to date in regards to the state stay-at-home order. With that, at the conclusion of that, we will go ahead and proceed to the questions from the media, but we're going to have a different format today where the media will be asked to call the number that was provided to them on the advisory that was sent to them earlier, and we'll hear their questions over the air. And with that, let me first start off again by introducing Jeff Toney, who is the Director of the County's Office of Emergency Services, who's going to talk about our operational situation and our COVID-19 response. Jeff?
Thank you, Chairman Cox. Today I wanted to provide everyone with a behind-the-scenes look at our COVID-19 response and our incident command structure. Currently, our Emergency Operations Center is activated at level 1. This is our highest level activation. We're opened every day from 7 a.m. to 7 p.m., and many of us are working much longer hours than that. We've got 24-hour duty officer coverage, and last week we did something unique. We embedded our Medical Operations Center, or our MOC as we call it, within our structure. And we're here to support the people working on the front lines. Our doctors, our nurses, our healthcare workers, public health department, and EMS. They've been working tirelessly for the last 2 months. And now the vast majority of our cities have proclaimed local emergencies. This is an all-time record for any emergency within the county. This shows you that this COVID-19 is affecting everyone. And we've taken a whole community approach to this response. Close collaboration with state, federal and local agencies, businesses, and volunteer organizations. In our Emergency Operations Center, we've had representatives from the Governor's Office of Emergency Services, Customs and Border Protection, the Sheriff's Department, County Fire, San Diego PD, the Red Cross, 211, the County Office of Education, and many, many community and faith-based organizations. Our COVID-19 response is our #1 priority. So we'll continue to lean forward, build capacity and capability, continue to support our medical professionals with this whole community approach, and continue to work together to keep San Diego safe and healthy. Thank you.
This time we'll call up Dr. Nick Ifantidis, who is our Chief Medical Officer. Oh, Dr. Wooten? Okay, Dr. Wooten is going to come up. She's our public health officer for the county.
Thank you, Chairman Cox. So good afternoon, everyone, and welcome again to our media briefing. Globally, novel coronavirus, which is causing COVID-19 infections, has resulted in over 260,000 positive cases and over 11,300 deaths. Nationwide, there have been 16,638 positive cases and 216 deaths. In California, there have been just over 1,000 positive cases with 19 deaths. Lastly, in San Diego County, there have been 131 positive cases at the close of business yesterday, and thankfully, 0 deaths. Next, I would like to address the frequently asked question of who needs to be tested. And we've spent a lot of time on that, and we just want to have everyone understand what that means. Our consistent messages at the local, the state, and the national levels are that not everyone needs to be tested. 80% of individuals that develop mild to moderate symptoms of COVID-19 do not need to be tested. These individuals can self-isolate at home, but if they develop more severe symptoms, particularly respiratory distress or difficulty breathing, they should then call their provider so that they can be seen and evaluated. The Centers for Disease Control and Prevention has issued guidelines that individuals with fever and cough can stay at home until their symptoms have resolved with no fever for 3 days without fever medication, and not or, but and, has been at least 7 days since the initial onset of symptoms. In addition to staying at home, it is vital that we continue to take additional steps to prevent COVID-19, and these are the measures that we've advised you from day one and during regular flu season. But this includes the frequent hand washing and habitual cleaning and disinfection of your personal space. You may ask, why are these simple actions necessary or important? The World Health Organization, the CDC, and other health authorities have emphasized that both washing one's hands and cleaning and disinfecting frequently touched surfaces daily are key in preventing COVID-19 spread. And I might add, it's not just disinfecting surfaces daily, but often throughout the day, particularly if other people are touching these surfaces. The fact is also that a simple cough can produce up to 3,000 droplets. These particles can land on other people if you're within 6 feet. And we've seen that popular depiction of a person sneezing and the droplets being in front of them. That's the viruses are inside of these droplets, and if you are within 6 feet, you can become infected. These particles, as I stated, can land on other people, they can land on your clothing and the surfaces around them. An NIH study found that COVID-19 virus survives on cardboard for at least 24 hours and up to 2 to 3 days on plastic and stainless steel surfaces. Again, this means the virus might last this long on door handles, plastic-coated or laminated worktops, and other hard surfaces. So again, the message to clean and disinfect surfaces around you is very important. Hence, this is the reason that we are urging people to clean and disinfect their surfaces in their environments and wash your hands after touching these surfaces outside of your home. Now, COVID-19 and other coronaviruses can be inactivated within a minute after disinfecting surfaces with 60 to 71% alcohol or 0.5% hydrogen peroxide bleach or other household bleaches. Before turning the mic over to Dr. Nick Ifentides, I would want to remind everyone that it is safer to stay at home. We emphasized this yesterday. This was the message of the governor's executive order. I ask again, both personally and as the county public health officer, that we come together in a collective manner to begin to bend the curve. Every one of us has a vital role in this goal. Please stay at home if you do not need to go out for essential reasons such as grocery shopping, walking your dog. taking a walk with your family, or for other important reasons, such as being an essential worker. I have faith in our San Diego County residents, our businesses, and organizations throughout the county that you all will comply with the governor's executive order to stay at home. Now, please welcome Dr. Nick Ifantidis, who will provide emergency medical services metrics and focused information for our local healthcare provider community. Dr. Ifantidis.
Thank you so very much, Dr. Wooten. Good afternoon, everybody. One of the things that I love about working in San Diego County is the passion that we have to make data-driven decisions. As a man of personal faith, my colleagues know that on a daily basis, I say to somebody, "In God I trust. The rest of you, show me your data." And on a daily basis, as the director of EMS, we look at data. And this morning, and this is very complimentary to what Dr. Wooten just mentioned, I saw something pretty remarkable on our data that might be a little bit counterintuitive. It was so remarkable that I had to call one of my epidemiologists and understand and make sure that I was interpreting things correctly. We follow, as I have said before, dozens of daily metrics. And with regard to what we are facing with COVID, I am paying particular attention to such things as the availability of ICU beds and the availability of respirators and the percentage of people that are going to the emergency room who have influenza-like symptoms, the number of available specialized services. This morning's data was very interesting, and while I completely affirm and agree with what Dr. Wooten just said, folks, we want to make sure that when we talk about appropriate utilization of healthcare delivery, that it is for the mild, what I would call sniffler-type symptoms, and we want to make sure that folks, either out of hesitation or fear of maybe being infected in a hospital environment, are not avoiding getting the care that they need. Believe it or not, the data and the reason that I had to call my epidemiologist this morning is that the availability of our capacity has actually grown. For a long time under our supervisor's leadership, we've been looking at issues like behavioral health and the number of people waiting in emergency rooms and so forth. Today, the number of those folks is very small. So there's a message comprehensively that needs to be emphasized here. Folks, you should not hesitate to get needed medical care if there are symptoms, whether they be physical or even emotional. Many people, especially during times of crisis, may be struggling with behavioral health concerns. We do not want you, because of all of this appropriate messaging about appropriate utilization, to not get the care that you might need. The other thing that's going on that I am so impressed with and so proud of in partnership with our hospitals, with our medical groups, with our federally qualified health centers, this challenge is now, in a sense, facilitating a new paradigm of how people get health care. Whereas in the past, maybe much more of it was in person, there are now alternative things going on, and at some future event, hopefully we'll have the opportunity to highlight some of the innovations that are doing and happening in our region with regard to teleconsultations and so forth. The important message is that we all want to make sure, with as much focus as we have on COVID, that if there are other issues, whether they be heart-related or the symptoms of stroke or depression and things that do legitimately require care, that we don't avoid that utilization, and that we pursue the availability now of enhanced alternative mechanisms with call-in nurses, teleconsultations, and all the things that are in place. Point number 2. We have been pressed pretty hard in recent days, and we welcome that. That's our job, and that's your job as the media, on the numbers of ventilators and PPE equipment and so forth. Based on communications that I've been having with a lot of healthcare providers the last couple days, I feel compelled to remind people, ventilators do not run themselves. The PPE equipment that we're concerned about isn't on the shelf. We are very mindful of the most precious commodity of our healthcare delivery system, and that is our healthcare workforce, the folks on the front line that we keep talking about. This past Wednesday night, in collaboration with HASDAC, the Hospital Association, and the Medical Society, and the county, we did something very unique that was very well received. We did a virtual town hall forum just for clinicians in the area. And I quickly want to acknowledge, doctors and nurses are humans too. And there are some fears associated. There's hardships that they're facing in terms of the lack of, their kids being in school and so forth. And so just as a fellow physician, I just want to call that out, acknowledge it, appreciate it. And as is appropriate with Dr. Wooten's guidance, we got to still maintain social distancing. But for those of you that live next to paramedics and nurses and doctors and firefighters and healthcare workers, maybe offer and see what it is that you can do to support them. The last thing that I quickly want to address as a medical doctor is a perception issue. Folks, some of you know me that this is somewhat of a personal issue, and I've been open about posting some of my personal ties to this in social media and so forth. And I am beyond fascinated, even among some of the medical colleagues, of the duality that exists right now between this is overhyped or we're not doing enough. And if I may quickly medically, I want to use an analogy because in some ways, though this is not a part of the country that we have to be ultimately concerned about this, the analogy that I use with my healthcare colleagues is, folks, we are really in the eye of a storm right now. And thankfully, with the interventions under Dr. Wooten's leaderships and all the things that have happened at the state level and at the local level, the hope, the anticipation is for that Category 5 storm to be lessened and to become more manageable. But we believe very strongly that it's coming. And the healthcare systems are activated. And even though this data that I referred to today shows lots of capacity, that could change. And so we are maintaining that posture of vigilance, knowing that it's a three-part posture. We're now preparing. There's going to be a storm of some magnitude. And then, of course, the comprehensive regional event of all of the recovery. And it's significant. And I will leave it at that for now and turn the microphone over to Supervisor Fletcher. Thank you.
Thank you, and good afternoon. We're continuing our briefings over the weekend to update you on the progress of what's happening and the continued actions and steps that are being taken. I want to say a special thank you to Jeff and all of our folks who are staffing our Emergency Operations Center, who are working incredibly hard to try and make a difference and make sure that there is broad-based communication and coordination between all of our sectors and all of our agencies and all of our entities, and we really appreciate their work that they're doing. Yesterday, I walked through the governor's new executive order related to his stay-at-home directive along essential services. Between the time that order was issued and today, our county and others have been working closely with the governor's office. I mentioned yesterday that there would be further clarification and guidance from the governor on what is essential services that should remain open. You can look at the entire 14 pages that they put out today to provide additional guidance and clarity. If you go to covid19.ca.gov, they have a full listing. I want to briefly outline a few key groups that residents and employers should be aware of that are further outlined in the governor's state action, and these apply for the entire state of California. They clarified restaurant carry-out and quick service food operations, including food preparation and delivery food employees, are essential critical government workers as defined by local agencies to ensure continuity of government operations and plans, county workers responsible for determining eligibility and safety net benefits, workers supporting public and private child care establishments, pre-K establishments, K through 12 schools, colleges, and university for purposes of distance learning, provisions of school meals or care and supervision of minors to support essential workforce across all sectors are exempt. Construction workers who support the construction, operation, inspection, and maintenance of construction sites and construction projects, including housing construction. Commercial retail stores that supply essential sectors, including convenience stores, pet supply stores, auto supply and repair, hardware and home improvement, and home appliance retailers. Workers that provide or determine eligibility for food, shelter, in-home supportive services, child welfare, adult protective services, and social services, and folks who provide necessities for the economically disadvantaged. Legal or accounting services which are necessary to assist in compliance of legally mandated activities and critical sector services, and faith-based services that are provided through streaming or other technology. We will continue to work with the Governor's Office and the administration as we all seek to continue to get further clarity and guidance on essential services and employment that should remain open. We have been working very hard with the City of San Diego, with other cities, with the Regional Task Force on the Homeless, on efforts surrounding the unsheltered. Our public health nurses have now expanded to be present in 9 different shelters: Alpha Bridge Imperial, Alpha Bridge Newton, Golden Hall, Haven House, La Posada, Operation Hope North County, Rachel's Women's Shelter, the San Diego Rescue Mission, and Veterans Village of San Diego. Now all have public health nurse staffing to screen the residents of those shelters to identify potential symptoms, and if they see those symptoms, to immediately remove them for further evaluation and consideration by higher level public health experts. Our public health nurses have expanded to 8 homeless outreach teams. We have, as we've outlined a number of times, public health motel rooms. We currently have 1,783. These are rooms for individuals who have a positive test, are a person under investigation, or unique categories of individuals with symptoms who are awaiting additional health screenings. I think it is important to let the public know that as we see a potential significant increase in testing in the coming week, we are likely to see a significant increase in the number of positive tests, and the need for these rooms could become exponentially greater. And so we will continue to monitor the situation along with our rooms. We had previously allocated 100 of these rooms to the Regional Task Force on the Homeless for unsheltered individuals who were seniors or had underlying health conditions but did not show any symptoms. As they have proceeded with filling those, we have now allocated them another 100 rooms for that purposes. But they are 2 different sets of room. One is a category of public health motel rooms, which are individuals positive, persons under investigation, or certain individuals with symptoms. The others are for the general unsheltered, and we will continue to work with those. I remain concerned about the lack of social distancing capacity in our homeless shelters, and we are working with the homeless shelters along with the City of San Diego and the Regional Task Force on Homeless on actions that we may take to try and address that and provide more sheltering opportunities. And we hope to have more substantive things to report perhaps as early as tomorrow. This was alluded to earlier, but there is a broader concern that we share about the overall mental and physical health of our population, not necessarily in direct response to being infected by COVID-19, but by other things that could be exacerbated by the actions we've taken. There is a concern about an increase in potential domestic violence, child abuse, drug or alcohol abuse. We've been working closely with Dr. Luke Bergman, our behavioral health director, on services and support that we can provide region-wide to help ensure that we are staying healthy as a society. We will continue to push out that information as well in the next day or two, perhaps some specific guidance with Dr. Bergman. And finally, I just want to comment on sources of information and uncertainty. Last night, I got a series of frantic messages from folks who said, oh, I heard you can get it from the water. And we've all heard a lot of things, but it's not true. And it really is important in this time of uncertainty and difficulty that we rely on our trusted sources of information. It is really easy to go down a very dark path on social media and on the internet with a lot of speculation and a lot of uncertainty and a lot of folks who aren't in a position to have accurate information sharing that, and that does nothing to help keep us safe. What helps keep us safe is listening to our public health doctors. Dr. Wooten walked through all of the ways it can be spread and all of the things and steps that you can take to try and address those issues. And so we really encourage the public to really rely on those sources. And I understand that we live in a world that increasingly feels at times devoid of fact. But our public health nurses and doctors are not ideological and they're not partisan. They're driven by data. They're driven by science. They're driven by research. And I can assure you that we will continue to provide you with every piece of information we have about the things that you can do and should do in order to stay safe in this environment. The same is true with the numbers and the trends and where it's headed. As soon as we as a county know, we will share that information with you along with all appropriate public health guidance. But it is vital that we do rely on those trusted sources of information. And as things change, we will continue to change. We will adapt, we will find new ways, we will share information. But through this all, I am really encouraged by a lot of the things that we're seeing out there. People coming together in remarkable ways. We launched a community response fund earlier this week, and we are adding almost $1 million a day to that fund. That's encouraging. I was encouraged today that our local labor council, in partnership with a bunch of nonprofits, did a food drive to help families who are in need. They helped over 500 folks, and they decided that, you know what, we need to do this every single Saturday. And they aren't the only ones out there doing it. But there's also individual actions that people are taking. I saw a welder who came out and said, hey, I'm available for any healthcare facility that needs something welded. I won't charge you. I have all my equipment. I'm not working. I'd love to come be a part of a solution if you need it. I was really moved by the story of a bunch of middle school kids who realized that their neighbor was a senior citizen in isolation. And so they took their band instruments and they went in her front yard and they played her a concert. Every single day, through all the uncertainty and difficulty, we see people taking these acts of compassion. And perhaps it took us being physically separated in order to begin to bring us back together. And that gives me incredible hope as we continue to advance through the uncertainty together with the spirit of hope, knowing that we can confront whatever happens. Thank you.
Thank you, Nathan. Before we get to the questions, let me ask if there's any need for clarification of any of our speakers this morning on any points made. Sure. Okay, before we get to the actual media questions, I've been remiss the last few days in not acknowledging and thanking somebody that's been with us at every one of these briefings, and that's our terrific American Sign Language interpreter that is here, Loisine Solman. Loisine, thank you so much for all your assistance. And with that, we're going to go to the questions. As in the past, we want you to please keep your questions to one question. We'll allow a follow-up if that's needed. But at this time, let's go ahead and take the first caller. Please state your name and your outlet before you ask your question.
Hi, KPBS. Please go ahead and ask your question.
Hi, yeah, this is Taryn Mento with KPBS News. I just wanted to know, when it comes to requests for PPE, have you or are you prioritizing hospitals over health clinics or other facilities when fulfilling them?
I'm going to call up Rod Sills, who's been one of our main logistics people.
Yes, I do appreciate that question. It's one that's asked a lot of right now. Currently, we have enough personal protective equipment to handle all of the healthcare entities within San Diego County. We are not at the point that we have to turn away, but at some point we will focus on the acute care facilities that are treating the coronavirus patients. We're not there yet, but we're monitoring the burn rate, like I said yesterday, so that we know how much we need to keep for a 60 or 90-day period so that we make sure the most vulnerable people are protected. To answer your question, no, we are not rejecting resource requests at all.
And as a follow-up, because we were said we could ask one, I have heard that. Is there any further comment you'd like to make in response to why we're hearing that a facility was told hospitals were being prioritized for a request, and we're still hearing that everyone's not getting everything that they need?
You know what, if you want to send me that offline, I'd be happy to follow up with those people, you know, because I'm doing that. I hear that as well, and when we dig down, we find that it's not the case. But I'll be happy to follow up with that offline.
Thank you.
Okay, next question.
We have the UT. Please state your name, outlet, and your question.
Hi, this is Rob.
Okay, go ahead and state your question.
Yes, this is for Dr. Wooten, but if any of the other people up there want to chime in as well. Dr. Wooten, you said there's 131 positive cases in San Diego County.
Mm-hmm.
Where is that? Is that X number more than yesterday, X number more than last week? And beyond that, is that an encouraging sign, a discouraging sign? Where are we? If you can put those numbers in some
To
sort of
perspective,
context.
sure. Yesterday, we had 105, so this is 26 more than yesterday. But recall yesterday, I said that as we are getting more commercial laboratories and more hospitals on board, more testing is occurring, and therefore, we should expect to see more positive cases. Okay?
That's not discouraging you, it's not,
No, it's not discouraging us. We expect to see, we know that COVID-19 is in the communities. Early on, our public health laboratory was the only entity that could test, and we could not test everyone. So as we have local commercial laboratories coming on board and hospitals, and actually we have more hospitals that will ultimately be on board in the next week or so, and as we also get other testing platforms. Our public health laboratory obviously has the CDC test kit. We are bringing on board next week a test kit from Abbott that includes all of the reagents, so we won't have that limitation. And then in several weeks, we hope to be up and running with the genomics instrument from Hologic. So more testing is coming on board, and we expect to see more testing and specifically more positive cases. So we're not surprised by this. Thank you.
thank you.
Okay, next question.
Hi, we have a new caller. Can you please state your name, outlet, and your question, please? If there's somebody on the line, can you please state your name, outlet, and your question?
Okay, let's go to the next caller.
Hi, next caller, can you please state your name, station, and your question?
Hi, this is Marilee Moore with Fox News. My question is, on average, how long are people staying in the hospital for average care, not acute care, just for average care?
Yeah, could you repeat the question?
How long are people in the hospital? It depends upon what other underlying medical conditions individuals might have. Usually if there are no complications with COVID-19, people might be sick anywhere from 5 to 7 days. People that are hospitalized, usually they're hospitalized because they have other underlying medical conditions, and those factors have to also be considered in determining how long the hospital stay is.
Okay, we don't have any other questions queued up, but do we have a couple of questions that were sent in earlier today, and we'll go ahead and ask those to be read at this time.
Yes, we have two additional questions. The first one is from Gina Yarbrough. She's with San Diego County News. People who suffer from depression can have difficulties in dealing with day-to-day life. Now we have COVID-19 to add to their plate. What advice would you give them, and are there any resources they can turn to for help at this challenging time?
That is a very good question, and I would call everyone's attention to our Access and Crisis line, and that number is 888-724-7240. This crisis line is open 7 days a week, 24 hours, and it has been actually in operation in San Diego since 1997. So we encourage anyone that needs to talk or has particular personal issues to call the crisis line so that they can get the assistance that they need.
Thank you so much, Dr. Wooten. Again, to reinforce, I really think there's a consideration here as well if folks have, quote unquote, their established medical provider. I want to repeat what I said before, that many of the medical groups, including many of the safety net federally qualified health centers, have really expanded their access for virtual interaction. And so that is one of the concerns and was one of the things that I was referencing in terms of the lower than normal utilization that we are currently seeing. And then it's been said so many times, but certain things bear repeating. Folks, this is a time to be physically isolated, but not socially, emotionally, or spiritually isolated. And I think that sense of community is so critical, and I'm probably going to be in the father doghouse for saying this, but you know, my oldest daughter is celebrating her birthday on Monday, and you know, there's a disappointment associated with not being able to have what we had planned, and so we're talking about doing something unique over a virtual platform so that there can still be that connection with her friends. And so that sense of belonging, that support, encouragement, that virtual accountability. Physical isolation does not have to involve emotional isolation. And like Dr. Wooten said, besides all of the formal resources, both specialized ones that the county has, as well as specific medical groups and healthcare providers, there's just, like also Supervisor Fletcher said, all of us coming together as community.
And this is Dr. Wooten again. I just want to emphasize the fact that for the Access and Crisis line, a language interpreter is always available. Within seconds, you can get the language that you need. So I think it's important to let people know that as well.
Thank you, Dr. Nick and Dr. Wooten. We do have, I think, 2 more questions to read.
The next question is from Jane Morton with CBS 8. For one of the doctors, can you please tell me more about younger people getting the virus? It seems younger people don't think they'll get it, but that's obviously not the case. What message do the doctors have for younger people?
The key message is that everyone is potentially can get COVID-19. And actually, I'll just read through the age distributions for the 131 cases that we currently have. For the age group, we have 1 case that is 10 to 19, and that actually is a 19-year-old. We have 24 individuals that are in the age group 20 to 29, 31, 30 to 39, 28, 40 to 49, 14, 50 to 59, and 10 for the 60 to 69 age group, and 15 for the 70s to 79 age group, and we have 7 that are 80 plus years of age. So you see through that stratification of the ages, young adults are susceptible to getting COVID-19. So I wouldn't think that for those youth and young people out there, you are susceptible and can get this disease.
Okay, I believe we have one more question that may be a 2-parter.
Two questions from Channel 10 News. How many drive-through testing facilities are available? And also, are there any updates if at-home testing will be available in the future?
Dr. Nick?
Okay, simple question, complicated answer. As I said yesterday, in terms of the drive-through options and these mobile alternatives, there are several. At this moment, I cannot quantify and give an exact amount because they are changing. Please know that we are preparing for the potential eventuality, if it is even necessary in the future, to expand on this strategy of doing this mobile testing. As Supervisor Fletcher emphasized, as well as Dr. Wooten, there are individuals in our community with whom we have to prioritize. And I would currently put them into 4 general categories. And the availability of testing that we currently have, we are really prioritizing the 4 following categories of individuals. Individuals who are hospitalized with meaningful, challenging respiratory distress and illness, individuals from or in skilled nursing facilities. As I referenced earlier, the most important healthcare asset that we have in our community, first responders, medical personnel, nurses, physicians, paramedics, firefighters, that is a very high priority group. And then, of course, the vulnerable populations that, based on the realities of their housing circumstances, are living in situations where the social distancing may be challenging based on the realities of a shelter. So forgive me, I cannot quantify because it changes every day. Some of the things that we have done were done as pilots to really work out the logistics, the protocols, the communication loop, the referral pathways, and all of those things. So decisions will be made, but I can hear Dr. McDonald echoing in my head. I want to say one more time what he said yesterday. Folks, more important than doing testing is the people who have any of the symptoms that we have discussed over and over again to self-isolate themselves. And if they have concerns, to then be in touch with the appropriate healthcare, if you would, advice lines that can help navigate whether or not their symptoms are at a point justifying in-person care or other interventions. One last thing I'll say, and again, it was with the assistance of Supervisor Fletcher yesterday, we are doing some very proactive things led by, for example, our EMS medical director in partnership with the state authorities. We have received approval, if we get to that point of needing it, for paramedics and EMTs to do sampling out in the field. All of that stuff is legislated, but we are proactive, prepared, and doing everything that we can currently based on the availability that we've been talking about over and over again of these tests. We are not encouraging nor promoting actively, and the ones that are out there are for individuals who get referred accordingly. Thank you very much.
Okay, I believe we have one more question that's been texted in.
Yes, our final question, Claudette from NBC7. How do we know our numbers in San Diego won't skyrocket once we start returning to our normal way of life, businesses reopening, schools starting up, etc.?
Well, I will start, and then I will yield the mic to Dr. Ifantidis. First of all, what we are doing now is being done to flatten the curve, and you've heard that phraseology used a lot. Because we do not have vaccines and we do not have antiviral medications, we are trying to flatten the curve so that we do not overwhelm our healthcare system and until we can get vaccines. Dr. Anthony Fauci has said that it will take anywhere from 12 to 18 months. And I know hope is not a strategy, but we hope really, that can occur sooner. There are a lot of organizations and researchers out there that are working on vaccines. More than one company is working on that, but it will at least be a year. So, and you've heard from the governor that this stay-at-home executive order, while it will be revisited at the end of the time period for which it exists, we may continue to do this for the next 3 or 4 months. So we don't know what the future holds, but we do know that right now, these are the best strategies that we can implement to prevent people that are vulnerable, people that are not infected, from being in contact with those that potentially are infected.
Okay, we're going to wrap this up. This was a new format, and we really appreciate the cooperation of the media and calling in and submitting their questions. There will be a press conference tomorrow at 2:30 that will feature Supervisor Fletcher and I believe Mayor Faulkner, and we're going to be focusing more on homeless-related issues tomorrow. But I would like to just close just by saying that Supervisor Fletcher gave a great example of well, we used to call these random acts of kindness. And I think what we're seeing now is more and more people realizing that, again, we're all in this together. The fact that a group of junior high school kids could get together on their own, hopefully keeping the 6-foot distance, but perform a concert in front of a senior's home is a great example of ingenuity among the citizens of San Diego County. We encourage that. Today is the first day of spring where we had beautiful weather, and it is beautiful outside. We encourage you to go outside, get some fresh air. If you want to go out and garden, if you want to jog or walk around the block, walk your dog, we encourage you to do that. Just make sure you do smart things and you keep that social distance. And again, you know, these devices are sometimes, I've cursed at them. Not anymore. These are indispensable. And so if nothing else, if you have some free time, call somebody you haven't talked to a long time. Call a senior or a neighbor that may be shut in and can't get out. See what you can do to help your neighbors. This is something that all of us can do together, and this is something all of us are going to get through together. With that, we'll go ahead and close today's media briefing. Thank you.